Great. I guess one way to think about it is if somebody is telling you something and selling you something, don't believe them.
It's certainly a red flag. There are cases where you can have a profit motive and still be giving people good quality advice. But certainly that should raise your eyebrows, particularly on social media.
Is the era of experts over? Is it, on the one hand, that these big institutions just didn't wake up to the social media world, or that people don't want to hear from experts anymore, or both, or neither?
It's a great question. And I think I'm going to turn this around to you at the end as former director of the CDC. I think that the concept of experts is, so like when people think of the CDC or the FDA or the NIH, my bet is that most people can't picture a single face, or maybe one face, like maybe the director, but not two faces. They probably don't know much about who those people are as people, what they have for breakfast. Do they have any pets? Do they have children? What do they like to do for fun? And so despite extremely high quality expertise, of the career scientists at all these institutions, there's a huge gap between us feeling like we have meaningful relationships with those people. And so historically, I think for decades, kind of the assumption in the field was that if the fields of public health and science design high enough quality studies and the resulting data have a compelling benefit risk ratio, and those data are written into guidances and distributed through public trusted channels, that sort of like decisions would make themselves for people. I don't think that has played out as much recently, particularly ever since COVID. We saw a turning point where experts or expertise, like you're, I think, correctly pointing out, it's kind of a pejorative almost. It's this faceless group of people
become a four-letter word.
It has. It's like this group of people who are trying to coerce you into doing what they think is best for your health. And I think part of why that's the case is because it is often very faceless, right? It's this press release or announcement, and you don't know exactly who it was who went into drafting the guidance for that. And so it just feels like, oh, it's kind of the ivory tower telling me what to do. Whereas people really make decisions based on human connections and based on stories.
You're the expert on you, right? So we can say, hey, I know a lot about tuberculosis. I can tell you a lot about tuberculosis, but whether you should be worried about it, well, I can tell you what your risk is, and then you decide, because you're the expert on you.
Yeah. I'm not sure that gap has always been well communicated by public health. I think you framed it well there. I think we've been a little too prescriptive in telling people, what they should do or what they should think. And at some point people say, that's not your decision to make. All I want is the best available evidence. And you can say what you think, the benefit risk ratio is for that decision, whether it's vaccines for your child or nutrition related information. But at the end of the day, if people get even a hint of coercion or patronizing sentiment from the institutes of public health, I feel like there's this defensive reaction, like, don't tell me what to do. I don't need you. I don't even know who you are. You don't have the right to tell me what to do for my family.
One of the things that I think is really hard is to communicate nuance. When I was at CDC, I always tried to make clear, hey, this is what we know now. This is how we know it. We don't know these other things, and this is what we're doing to try to figure them out. So based on what we know now, here's what we're conveying. But I think nuance is hard. One way I think of it is there are things about which we are virtually certain. There are things for which there is strong scientific evidence, but we might be wrong because we learn more things and we change our minds, or the facts change our minds. Scientific evidence that might be right, but might certainly be wrong. And then there's a fourth category for which there's really no valid human-based evidence. But that kind of flies in the face of this is the fact, and this is the fact, and this is right, and this is wrong. And it's really kind of hard to say it's complicated and not lose people. But you do that. So what are your thoughts about how to convey nuance and uncertainty?
I've changed my mind about this since I started making content. First of all, I'm not trained in public health communication at all formally.
It probably
I'm a bench scientist by training. It probably maybe, actually, come to think of it. But early on, I started with the what I now consider to be too oversimplified type of messaging.
Mhm.
And now I think of it as like vaccines are safe and effective style of messaging. Over time, what I've come to appreciate is people have an incredible appetite for nuance. People with no scientific training, they're not physicians, they've maybe didn't study science whatsoever, still want to sit down and listen for 5 minutes if it's a topic that feels important for the health of themselves or their children or their grandchildren. I did a video a couple months ago about the hepatitis B vaccine, which can be a pretty boring topic. It got like 10 million views. I think it was 5 or 6 minute long video. You wouldn't think, sort of traditionally, you say in public health, you have to talk to the level of, I don't know what it is, a fifth grade reader or a sixth grade reader or something. I found that to be totally not true. Certainly, you
Yeah.
don't assume that people know jargon, but bring them along, show them the data, show why you think what you think about a given topic. And that's exactly what people want to hear. People don't want to hear vaccines are safe and effective, as an example. Everybody's already heard it. It's been overused to the point of, I think, being meaningless and just being polarizing with no real value. And maybe worse than that, what I've learned, and this wasn't clear to me initially, but I've learned that some people hear that phrase and think vaccines have no risk. And then when they go to find out, well, actually, vaccines sometimes do have risk. Sometimes it's very serious risk. What that comes across as is, oh, you lied to me. You lied to me to try to get me to take your vaccines that I didn't want to take. When in reality, of course, you and I both know what you mean to say is that the benefits outweigh the risks of vaccines and the disease is more dangerous than the risks of the vaccines, which is a mouthful to say. It doesn't make for a good slogan. But I think if the goal is to hand people the information that they need to make the best decisions for their family, people really want, like, they're willing to sit down for 5 minutes and hear about an important topic. It doesn't have to be compressible into a 10-second soundbite.
It's an important point. And to be fair to public health communication, some of the principles still stand. Be first, be right, be credible, be empathetic, give people practical things to do, and don't underestimate the audience. Share uncertainty. This is really important. Don't underestimate people's both desire to learn more and ability to hear. At the same time, I do worry that bad information with a simplistic summary travels faster and wider than the nuanced explanation.
It does. And I think that's the constant uphill battle, no matter how you frame it. It takes you 3 seconds to hear something like the COVID vaccines cause heart attacks or whatever, or cause miscarriage during pregnancy or something. You can understand that message instantly. And, sort of as a general precaution, you're going to err on the side of safety and defensiveness when you hear something like that. Whereas to debunk any one of those statements may well take you 5 minutes. So here's the data why we don't think that's the case. And I don't exactly know what there is to do about that, either than to kind of pre-bunk ideas about, like, you may hear this is why it's not true. That can reduce all of our susceptibility to believing things, whether they're in the health sector or political sector, whatever it might be on social media. If you're kind of defended against it ahead of time, you're less likely to fall into this sort of passive, I think of it almost as passive scrolling, when you're on your feed and you see like 3 entertaining videos, and then all of a sudden you're kind of in the state of just sitting back, receiving information. When you get presented with health information in that context, you're not really like mentally equipped to try to be dissecting an argument. You're just in like receiving mode. And so sometimes it's helpful to try to snap yourself out of that passive receipt of information when you sense that you're being told some form of health or scientific advice, to try to really question, what exactly are they telling me? Is that backed by the evidence that they're presenting? How does this match with my pre-existing perspective, right? Is this confirming something I feared to be true or that I hoped would be true? That's asking a lot, though. Often we're exhausted when we're scrolling social media, or it's in a dark bedroom at night and you've got the sound all the way off and the screen brightness is low, and you're not looking for rigorous medical debate necessarily. It just kind of happens upon you. And I think we're most susceptible to the exact type of things that you're saying there, like this short, pithy, sometimes scary messaging that hijacks these emotional responses in our brain. And then, often conveniently, there's a solution of, well, this may be a sign that your magnesium is dangerously low, but fortunately for you, I've got this $30 per month supplement that you can, buy to fix your issues. Uh,
To what extent do you think this is driven by the profit motive, and groups that are monetizing misinformation, and the algorithms that are kind of invisible and leading to our streams? And to what extent do you think it's just kind of part of human nature to want a simpler answer?
that's a great question. Uh, so I think that each of these parts play a different but important role. So the human nature part, I think of this almost as it's like you're driving and you see a car wreck up ahead, and all the cars ahead of you are slowing down to look at it. When logically, what they should do is just keep looking at the road, right? Don't look sideways because you're going to run into the person in front of you, whatever. And you may say that about the people 20 cars in front of you, but when you get to the accident, there's a good chance you're going to sneak a peek and see what's going on. And so it's almost the same thing on social media. You can ask people, what type of content do you want to see next time you're scrolling? Do you want to see negative and emotional content and political content and controversial content? And people will tell you, no, that's not what I want to see. But then in practice, when we get onto the platforms and we're scrolling, those types of videos come up. Turns out a lot of the time we stick around and you watch the video, and you may not like it, you may not comment, you may not share. But to the algorithms, right now, the most important feedback you can give to them about whether you want more of this type of thing is, are you sticking around to watch through the whole video? And so then when that happens in the real world, even that's what you say you don't want to have happen, it gives you more of that content and also amplifies that content to more people elsewhere. And so that's where the disconnect is between, logically, people know, I don't want to see this. I don't necessarily believe this. It sounds scary, but I know it might not be true. And yet, if you stick around and you kind of watch it for a little bit, it gets amplified like crazy.
So that's the human nature part of it. But what about the profiteering and the algorithmic part of it?
Yeah. Initially, I
Or is
thought,
the algorithm just, sorry, but is the algorithm just kind of an umpire calling balls and strikes? If you watched more of it, you're going to see more of it.
I do think of it as not being different from the audience. And other people have talked about this before. But sometimes people will say, well, the algorithm doesn't like evidence-based health content, or the algorithm prefers misinformation. In reality, all the algorithm wants is for you to stay on the social media platform and have as good of an experience as possible, so it can serve you more ads, so it can sell you more products through its connected marketplace. And so the algorithm developers are doing their best to reflect human attention of the actual audience. So I don't think of, the algorithm doesn't like health-related content. I replace it with the word audience. And then it starts to not make too much sense. If you say the audience doesn't like evidence-based health information, it's like, well, of course they do. No one is looking for wrong information about their health for themselves or for their children. So what is it then? It is this emotionally charged messaging that tends to be sticky, that people tend to watch. And so the algorithm, it's kind of agnostic. It's really just looking for signals of, do you like this type of thing that you're watching? Are you sticking around to watch it? If so, I will give you more. On the profit side, I used to think that, most of these evidence adjacent supplement peddling wellness types of accounts
It's a very
were
polite way to put it.
yeah. Well, sometimes there is, a shred of evidence, mechanistic evidence, but
Often
not.
there is. Often there's some kernel of a theory, but no real evidence of efficacy. And that's a hard point to make to people, right?
It is. I've
But
got
anyway,
one
you were
favorite
saying,
story. Yeah, no, we should come back to that because I've got
yes.
one good for me that has worked to remind myself of this. But I used to think people did this mostly for profit while knowing that they were giving bad information. What I've come to think instead is that most people truly believe that if they say, if you take this thing, it'll make you sleep better. It may help with your depression. It may balance your hormones, which is not, exactly a medical claim. But the point being, I think a lot of people making those types of claims truly believe those claims. I think it's very hard to make these types of claims and sell these types of products to people knowing that there is no actual benefit. And, the fact that you might be making $10,000 or $20,000 per month in doing so maybe makes it a little bit easier to believe that internally, subconsciously. But I think at the end of the day, a lot of people do have good intentions, but they may not have the type of scientific training to necessarily know the quality of the recommendations they're making. On the mechanistic data thing, My favorite story is actually about antioxidants. So, antioxidants are a good thing in general. You eat fruits and vegetables, you get these bioactive compounds that are associated with a range of good health outcomes in cardiovascular disease, and interestingly, in reducing risk of cancer. There's some good observational data from decades ago showing that people who ate more fruits and vegetables had higher blood levels of certain antioxidants and had lower levels of lower incidence of lung cancer. So a good randomized control trial was designed called the CARROT study, which looked at the effect of giving people a supplement with high dose concentrated antioxidants, people who are at high risk for lung cancer. What they found, though, was that actually people who were getting that high dose antioxidant had something like a 28% higher incidence of lung cancer, 17% higher incidence of mortality. And so the trials had to be stopped early, actually, because the increased risk in the active group was so apparent compared to the blinded placebo group. And that's a good example to me. There's a real risk of us sort of reading the observational data and seeing, oh, people who eat lots of fruits and vegetables have higher blood levels of antioxidants. Therefore, I should go buy this antioxidant supplement because if a little bit is good, more is better. That's not always the case. Sometimes not only is it not better, sometimes it's more dangerous. And I think that's sort of the basis for a lot of the profit-driven market that we see on social media. There is this trap, like you say, of mechanistic evidence, sometimes in rats, sometimes it's in humans, sometimes it's observational evidence. But that gets extended all the way down the spectrum to say, and therefore, everybody should take the supplement. And that can have real harm.
Yeah, I think in the typology I mentioned earlier, from virtually certain, highly likely, possible, and no real evidence, most of these things fall in the no real evidence category. And I recently, when finishing my book, Formula for Better Health, I said, let me look at all of the claims and look at how much of an impact each of the different things can have. And I actually couldn't find a good source for that anywhere. So what I looked at was, actually there's 6 things that are the most important for a long and healthy life. And there's a nuance on each. Blood pressure, nuance down to 120 over 80. Lipids, nuance with a LDL-C down to 70 or less, or other lipid measurements. Physical activity, the best thing, better than any drug, better than GLPs, physical activity, but minimum dose, 4 days a week, 30 minutes, brisk enough walk outside ideally to get a little out of breath. Enough sleep, 7 to 9 hours. Avoiding toxins, including tobacco and alcohol, and healthy nutrition, which is the most complicated, but it's not really that complicated. More fruits and vegetables, more potassium-containing foods, less sugar, less processed meat. People talk about the controversies in nutrition, and there are a lot of them, but that guidance really hasn't changed in 40 years, and it's right.
Yeah. And so the trouble is, I think, no one will be surprised by that list.
Right.
Everybody
It's boring.
knows
It's
what we
boring.
should do. Yeah. It's the boring stuff. But there's always this hope like, oh, well, what if there actually is this protocol I could do that could achieve some of the same benefit without having to do the same, physical activity X number of days per week or whatever it might be. It's just not very interesting to talk about getting your cholesterol to under 100 or under 70 or whatever it might be. That's a big challenge, I think. You see like sauna and red light and cold plunges. Those all make for very interesting content to watch on social media. Eating more fruits and vegetables is not particularly
Eat your
well-performing.
vegetables is not exactly a rallying cry that's going to make you a lot of money. And, mechanistically, there are these series of really well-done studies about sauna use in Finland that suggest that it may be healthy, but you're talking about people who use saunas 4 and 5 days a week. So it's tricky stuff. Let's talk about audiences for a minute, because there's a real risk that we're preaching to the choir, that we're only talking to people who are already convinced, who are providing information to them. At the same time, there are certain people who are never going to engage. So there's a movable middle, or there are people who are genuinely curious, who may be influenced in an unhealthy direction, but want healthy information. Uh, Are we reaching the people we need to reach?
This is a very important but hard question to answer. As someone who makes content on social media, it's hard to tell, if I make a video and it gets 10 million views and I make another one and it gets 100,000 views, which of those two videos had a bigger impact? I can't tell you based on that data alone. It's possible that the one with 100,000 views actually changed people's minds on something important and led to actual differences in behavior in the real world. And it's possible that those 10 million views were with people who already agreed with me, who liked hearing something they already believed. It's really hard to disentangle. What I can tell you is that here there is some value from the vitriolic comments that I get sometimes that tell me I'm not just reaching a bunch of people who already agree with me. I am at least being seen by and heard by people who definitively don't agree with what I'm saying. But it is exactly that. It's reading anecdotal kind of comments here and there. At least this is the best approach I have for figuring out, who am I reaching? Am I actually changing anybody's decision? Sometimes I'll get DMs from people saying like, oh, the way that you talked about this actually did change the way that I think about this. Or I shared this with my mom or something and it changed her mind or something. But it's always anecdotal. I can never put a number to, what was the actual impact of this video that I made, other than how many people saw it, how many people hit the like button. I think that's a core challenge and that's not unique to social media, of course. You can run a TV ad for a public health initiative, and there you have even less data. You're not even getting comments at all. You have to do sort of specialized, as you know.
We actually did with anti-tobacco ads. We were able to try different ads, and we figured out what worked based on calls to quit lines, and triangulating that with data on how many people were smoking. So we were able to do some really good evidence-based work on what works for anti-tobacco ads.
Oh, that's fantastic. So you were looking for upticks in calls after running a particular variant of the ad, and then you tested a different one.
Yes.
That's amazing.
And can you predict what will make what makes for the most effective anti-smoking ads? Well, I don't want to.
Probably not. I don't know. I'm not fear-based is my guess.
Wrong. It's actually showing disability and disfigurement. People really don't want to look bad and not be able to do the things they want. So
the exact opposite of what I guessed.
Well, not death, not telling people they're going to die, because if I'm dead, I'm dead, right? But showing disability and not health, because like it doesn't seem real or whatever. And this is a very consistent finding. We did it in New York City when I was there, and we did it nationally. And these are ads that have saved tens of thousands of lives and billions of dollars in healthcare costs. One of the people who recorded them, Terry Hall, was a cheerleader from North Carolina. She started smoking in high school. She got cancer in her 40s, and millions and millions of people saw her ad. She saved more lives than most doctors will in their career because of the vivid story that she could share. But
we just follow-on question for that. We just dipped below 10% prevalence of smoking adults in the United States. What do you see, having done so much work in smoking campaigns, what do you see as the floor for that? Have we hit, is that the lower plateau that we're gunning for? What should it be?
Morgan, when I began work as a disease detective, epidemiologist for the CDC, Epidemic Intelligence Service officer, one of my colleagues did a study that showed that 6-year-olds were more likely to recognize Joe Camel than Mickey Mouse.
Wow.
And the rate of teen smoking was 36%. Today, the rate of teen smoking is 4%. And most people only start as teens. And if you look around the world, you've got countries that are coming down to low single digits. There's a lot of ways to make more progress on tobacco. And there's a generational change, and there's huge risk because it's a highly addictive substance. It's engineered to be more addictive. And there are things we can do to prevent people from getting that addiction and also to help them break it if they want to break it. But I want to come to a couple of questions before we end, maybe more of a rapid round.
Sure.
But a tough one. We've been talking about information and echo chambers and who listens. I worry that at some level, there was an acceptance that we're all in it together. to an extent that is fading. That Moynihan famously said, "You're entitled to your own opinion, but not to your own facts." That people feel now entitled to their own facts and their own opinion, and they don't think maybe what I do or what you do affects other people, and yet we are reliant on others in really important ways. Whether it's for them not to run over our kid when they're walking to school, or to provide services in the community or a positive environment. Are we losing a sense of community?
That's a tough rapid round question. I do fear kind of for the fabric of the societal bonds that we have with each other. It feels like, every topic now, where it can be, is turned into a polarizing and tribalizing issue. Even stuff that used to be very sort of purple issues. I think that science and health used to be a very purple issue, but increasingly now we're figuring out ways to divide topics up and say, if you believe this, it's for this party. If you believe that, it's for that party. Do I think that's reversible? I kind of have a narrow view into this, at least within the scope of content that I make. I certainly think it is. And so part of that is I do see a lot of reach to people that I don't think agree with me, perhaps politically, but do find common ground on topics in science and health and medicine. I think a key step in sort of rebuilding that shared fabric in public health, and to me, this is sort of a central and existential question in public health, is whether big, credible organizations will make the plunge to figuring out how to do this type of communication better on organic social media. Excellent quality studies and press releases aside, can they figure out how to connect with people and build relationships with people where people are actually spending attention, which increasingly is not on cable news and it's not in newspapers. It's certainly not reading press releases. It's here on Instagram and TikTok and Facebook. Whether big medical and scientific organizations can figure this out and pretty quickly and build those relationships, I think is going to be key to sort of building that shared trust in the institutions of science and medicine.
And yet there's a real conflict. You've highlighted that people have to understand who the individual is, and it's an institution. So there are a lot of negative incentives if you're a member of an institution in stepping out and showing your personality. And it may be frowned upon, or it may not be welcome even by the public.
Yeah. And I think that's why we haven't seen it to date. I think it would take sort of a top-down, almost incentive program within the CDC. I'd be interested to hear what you think, how you think it could be done, if you think it could be done, to give people, like, this is your job, is to make relatable content about this topic on Instagram, on TikTok, on Facebook. Do you think that could be done? I've heard from other people in the past I've spoken with that this type of nimble and responsive and platform organic content simply can't be done within the framework of the CDC. Do you think that's true? Do you think what would it take for this to happen, for the CDC to get really good at this?
So I'll give you an analog example, not social media, but one of the things that we did, we realized that a lot of folks didn't understand what CDC did. So we found people all over CDC who came from little towns all over the US, and we had stories in the local paper about what their favorite daughter or favorite son had done. And that was really effective. And I think that does translate to social media. But there are issues of accessibility that need to be addressed, of clearances, of trust, of, if you make a mistake, you got to be able to say, hey, I made a mistake and I'm going to correct it now. But CDC is a large institution, and you have the world's best experts in essentially everything there. So if the public wants to know about this rare fungal infection, hey, it'd be great to have someone say that. Now, they may not be great on social media. They may require some coaching, or they may be great. So I think this is something that needs to be done, but it won't be easy.
But you think it could be done?
I think so.
Would
I
it
think,
be a
if you look
top-down?
at,
Who would be the person to say, we're going to do this, we're going to make a hard effort over the next 3 years or 4 years or something?
If you look at some of the best communicators during COVID at the state level, people like Dr. Ashton in Ohio, she was really effective. And, some people are born great communicators, and some people have it thrust upon them. So you have to see who's going to make it work well, and then build on that. But yeah, I don't think in any way it's hopeless. I think having a feedback loop and saying, hey, you know something, you made that, and 99.9% of people who started watching it didn't finish watching it. Well, you're going to have to change. So basing decisions on data, that's ultimately what public health is all about.
I'm glad to hear that. This is my hope for what I hope to see play out in the years ahead. It's for me, for people like me, to not really have to be doing this because other people like me within the CDC and NIH and FDA are doing it with much better resources and much better access to career experts. So I don't know. We'll see how that translates, though.
Let's hope. And let's hope, as a final thought from me as we close, that helps rebuild our sense of community. That helps rebuild our sense that, hey, we can disagree about a lot of things. And there's a lot of science that isn't settled, and let's be open about that. But let's agree that we all basically do want to live longer, healthier lives. Let's leave aside what we believe the motivations of other people are, and let's focus on what we want to do, what we want to learn, what we know, and what we can do together to live longer, healthier lives.
Well, thank you for the invitation to chat. This is great. I think we need more of this.
Thank you. And thanks for what you do. You do a superb job of explaining complicated things simply. You know, simplicity is not a compromise. It's a design principle. And if you understand something well, you can explain it well. So that's what we should all aim for. Thanks very much. It's been really a pleasure speaking with you.
Likewise. Thank you. Talk to you later, Tom.
Talk to you soon.